Hi, welcome to tensor fascia lata and sartorius. We are beginning on page 324 in your book. We're going to go right to screen share. Okay. So here we are with tensor fascia lata. It looks like latte, and sometimes I say tensor fascia latte because I like to say it that way, but it's tensor fascia lata. TFL is right here. It's small but mighty, okay? It attaches directly to the iliotibial band, which is a sheet of connective tissue that stabilizes the lateral leg. Okay, because we are bipedal and upright, we do shift side to side quite a bit, even when we walk. I don't know if you've ever felt that when you walk, you do shift a little side to side. So we have a lateral stabilization built right in, okay, to prevent excess movement and falling over. Bonus. So TFL sits more anterior than it does posterior, but it is right on the side of the body. Its origin is the iliac crest, just posterior to the ASIS. So that's kind of the easiest way to palpate this muscle, is to find the ASIS and slide your fingers just posterior, okay? You will come across just a little thickening right there, as this muscle, like I said, is small but mighty. It is sometimes rather tender to the touch. Its insertion is the iliotibial tract. As I mentioned, it attaches directly to it. So this muscle is more anterior than posterior, so it does anterior things. It flexes the hip, medially rotates the hip, and abducts the hip. So what these all look like, if you put them together, is like a dog peeing on a hydrant. So flexing the hip, and I'll do it because I know you want to see me do this, of course. All right. So TFL, let's see, let's get in the pocket here. TFL is right there. Okay. There's the ASIS, and then this little, I don't even know what these pockets are for, to be honest. Thought it was a watch pocket a long time ago, but this is entirely too small for that. I don't know. If you know what these little pockets are for, cool, you let me know. All right, so here's the ASIS, and then right in that little pocket here, see, it's before the seam. So if you've hit the seam, you've gone too far. It's anterior to that. So it's going to be in that little, well, we're going to call it a watch pocket, whatever. Okay, it's right there. So I just put my fingers on the ASIS and then slid my fingers just posterior to that. So the actions for this: flex the hip, medially rotate the hip, and abduct the hip, okay? When you do all three of those together, flexion, medial rotation, and abduction, you can really feel TFL engaged. It'll pop up to meet your fingers. Flexion, medial rotation, abduction, okay? You end up, like I said, looking a little like a dog peeing on a hydrant, but those are the actions. That's what it does, okay? Now, your book talks a little bit about the iliotibial tract on page 324, or iliotibial band. It feels very different than the muscle below it. Vastus lateralis sometimes is tight, but the IT band is definitely a different texture. We will palpate this in class so you understand the difference between the two. And that's TFL, just such a cute little muscle. So adorable. Let's just check it out over here. There it is right there. There's TFL. What I like about visible body is they actually kind of make the muscle continuous with the tendon. They don't separate it like your book does. This is more what it would look like. Okay, it is continuous with the tendon. These muscle fibers then become tendinous fibers. So there's TFL, and it just highlights the whole thing in blue here. okay? And then of course, down here, if you're highlighting that, that would be the IT band. Okay, just swing them around here. See, more anterior than posterior, so you have that flexion of the hip because it crosses the hip joint, of course. Medial rotation and abduction of the hip. All right, so while we're here, I'm gonna hide that fascia there. Next up is Sartorius. That's this one. I'm gonna back this out a little bit. There we are. Sartorius goes all the way from the ASIS down across the anterior thigh. Okay. Sartorius is the longest muscle in the body. Mentioned that. And it's also called the tailor's muscle. See this little image right here? This is somebody sitting in a figure 4 position with something on their lap that they are fixing with needle and thread. I can't really tell what that is, to be honest. That's okay. Sartorius is on page 326. And this particular muscle is superficial, but is very difficult to palpate because the muscles that are deep to it, the quadriceps group, are so much stronger and so much bigger. This is a thin, flat, strap-like muscle. And in fact, Sartorius, the word actually means tailor. As you put yourself into this position to be a tailor, I guess, putting the fabric on your lap. I don't sew a whole lot, so I don't know. My sewing skills are average at best. All right, so origin is the ASIS here. Okay, so it originates just above the origin of, that's right, rectus femoris. Okay. So origin is the ASIS, and the insertion is the pes anserinus. Dun, 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 dun. This is our third muscle that attaches to the pes anserinus. So let's take a look at that, shall we? This is the pes anserinus. This is page 352 in your book. The pes anserinus tendon is a combination of 3 tendons that makes a goose foot-like pattern, because that's what pes anserinus means. It means goose foot. Okay, so I don't see it, but maybe you do. You get a goose foot in there somewhere, whatever. But it is on the medial side of the tibial tuberosity here. So if we're looking for an actual attachment site, it is going to be just medial to the tibial tuberosity, below the tibial condyle, medial tibial condyle. Okay, so that's approximately where it is. But the pes anserinus is what it's called, the attachment site. So we have 3 muscles: gracilis, sartorius, and semitendinosus. Gracilis, sartorius, semitendinosus. Those are the 3. I know you were in suspense and you just could barely stand it. You needed to know what the 3rd muscle of the pes anserinus tendon was. Well, now you do. Yay! Okay, so Sartorius has 5 actions because it takes 5 specific actions to get your body into a figure 4 position with your hip and knee. So here's what they are. First of all, you have to flex the hip. Then you have to laterally rotate the hip. Okay, that makes sense. We've got flexion and lateral rotation here. Great. You also have to abduct the hip to get it out to the side. Then you have to flex the knee and medially rotate the flexed knee. So you can't really see it. Again, this is rather difficult to show, but the medial rotation of the flexed knee kind of occurs when the ankle is on top of the opposite thigh here. Okay, you're just pulling the medial tibia towards the hip a bit when this muscle is contracting. That's the medial rotation of the flexed knee. Okay, so 5 actions. 3 at the hip, 2 at the knee. So if you're doing your bullet points, make sure you've got 5 actions for Sartorius. Okay. We will try to palpate Sartorius in class. However, like I said, because it is so thin and so flat, it is very difficult. We may be able to palpate closer to the ASIS when we do the actions of these muscles. But if you just have a client laying flat, supine on the table like this, it's very difficult to just put your hand right on Sartorius here. So you can see how long this is. I'm gonna kind of, there we go. Show it like that instead. Wraps across, there we go. Wraps across the anterior thigh and then inserts on the medial tibia there at the pes anserinus. Let's move me out of the way for a second. Sartorius, and you can see it will only show you certain actions. It will not show you every single one. So there's Sartorius doing some of that medial rotation here of the flexed knee. That's what it's trying to show you. See, there's the flexed knee. Medial rotation of the flexed knee. Can you see? I'm pointing. You can't see me point. Good Lord. Okay. There's the medial rotation of the flexed knee. It's rotating away from you, or if you swing it this way, it's rotating toward you. See that? Okay. Oh, I can draw, but I'm not going to. That was an accident. Cancel. Okay, so we've had all of the muscles for this unit. We had the hamstrings, we had the quadriceps, we had tensor fascia lata, and Sartorius. Okay, there's only one more structure that I need to show you. I have introduced it to you before, however, now it is time to formally learn it. So we're going to go to page 336, and I'm going to go back into the screen share. I might as well. I'll go back to the book here. Page 336. Remember, we talked a little bit, just a little bit, about the femoral triangle endangerment area. Now we actually have all of the borders for it because we've added Sartorius. So we have the borders for the femoral triangle are the inguinal ligament, right? We have adductor longus, which is in here somewhere, but you know, quite honestly, it doesn't really matter. Everything's in front of it, so I can't see it. Adductor longus, and then here we have Sartorius. That's the other border for it. And you can see everything that's in there is not entirely superficial. However, it's showing it like it is, which is okay. Some of these drawings are very misleading because it looks like things are at the forefront and they are not. These lymph nodes are most likely a bit deeper, although sometimes you have some superficial ones. You know, this femoral nerve is more superficial, but then dives deeper into the muscle here. The femoral artery, you can feel that's pretty superficial right in here, which is good because if you're working in the femoral triangle here, like you're trying to palpate adductor longus, let's say, and you feel a pulse, get off of it. As a general rule of thumb, if you feel a pulse, get off of it, okay? These are large blood vessels in here. You'll only feel the pulse in the artery, but the vein is right next to it. So if you are on the artery and you feel the pulse, move your fingers so that you are most likely off of the vein as well, okay? But again, everywhere that you make a bend, everywhere that you have a fold, not necessarily a joint, but a fold, there are going to be blood vessels, nerves, and lymph nodes. So these are all endangerment areas, okay? But you should know the borders of the femoral triangle here because it is an endangerment area for this, well, these last 2 units actually. Okay, last 2 modules. All right, so that is it for this particular module. You have your muscle chart and you have your workbook pages, and next up is the midterm. See you soon.